headed into another summer weekend on Cape Cod, but concerns about breakthrough infections are certainly at the top of mind for a lot of people.
Dr. Shira Darone's the hospital epidemiologist at Tufts Medical Center. Dr. Darone, good to see you.
You too.
All right, so it has been a week with a lot of COVID news, and a lot of it has not been great. These infections are getting a lot of attention right now, but we want to point out the vast majority of people hospitalized, more than 97% for COVID-19, are unvaccinated. So what do we know, though, about what's causing the few vaccinated people who are getting the virus to get it? Is it changes in behavior, or is it just simply the Delta variant?
It's both of those things, but breakthrough infections are what we expect because the vaccine isn't 100% effective. Now, some proportion of vaccinated people will get infected. It's usually asymptomatic or mild infection, and there will be more of them when there are more cases out there, which is what we're seeing. There will also be more breakthrough infections when vaccinated people do things they didn't do before, like spending time in crowded indoor spaces, but that is now their personal choice. And because the Delta variant is so much more contagious, it's going to penetrate that armor that the vaccine provides a little more easily, but the vaccines are proving to be remarkably effective against the Delta variant.
Well, and speaking of that variant, the CDC Director Rochelle Walensky is now calling it one of the most infectious respiratory viruses ever seen by scientists. So what does that tell us about how the virus is mutating and potential risks down the road?
You know, things were looking so good. Cases were plummeting across the country and much of the world, and the Delta variant really changed that. It means we need more of our population to be immune, either from vaccine or infection, but preferably vaccine before this thing ends. And it means we have to do everything we can to vaccinate not only as many people as we can in this country, but in the entire world, because becoming immune from vaccination is way safer than becoming immune from infection, because that carries a risk of severe disease and death.
Well, the Olympics are officially underway in Tokyo. There have been a lot of protests. There's rising COVID cases in that country, and Japan's vaccination rate is comparably low. Only about 23% of residents are fully vaccinated. No fans in the stands at these Olympics. And what does that tell you about other big events in the future? Are we still a long way from a return to normal with those really big gatherings?
We will simply never be able to comfortably have big indoor events without running the risk of it leading to a lot of illness until we vaccinate the world's population. The vaccine is the only way to normalcy. We have to figure out how to get more people vaccinated. Just like we never worry about getting measles at a concert or a sporting event, that's where we could be with COVID-19 if everyone were vaccinated.
All right. Well, Dr. Darone, Tufts Medical Center, thank you as always for joining us.
Thank you.